Good evening. Welcome to Community and Technology, where we connect the global community with news, information, and resources to hopefully help improve your life. I'm your host this evening, Stu Reid, and we have two very special guests. First, no stranger to the airways here, Miss Diana Blackwell, the president of Fred Samuel Houses and also the president of PSA 6 Community Council in Harlem. Diana's a frequent contributor to Community and Technology and a co-host of our monthly program on UBI, Unconditional Basic Income. Welcome, Diana.
Good evening.
And we also have a new guest, Mr. William Smith. He's a lifelong resident of New York City, raised in East Harlem, El Barrio, and is a graduate of the City College of New York. He has extensive experience working in areas of business administration, compliance, and government affairs, including working on public housing, stakeholder engagement, and policy formation for the New York State Assembly. William is deeply committed to empowering communities across New York City and better understanding the political process through civic education. Welcome to Community and Technology, William.
It is a pleasure to be here. Thank you so much for the opportunity to be part of the conversation.
Absolutely, absolutely. I'd like to start with you, William. Tell us a little bit about your experience. Looks pretty extensive in public housing advocacy. Give us a thumbnail of your background and how you came to be who you are today.
Well, for one, I just want to say, first, I want to give a shout out to Ms. Blackwell. Ms. Blackwell was a great partner with me in my time working, engaging the community of the 70th Assembly District, as well as the broader public housing community. Ms. Blackwell was an immense asset in terms of providing insight in terms of public safety and just general safety issues for public housing. So I just want to make sure I highlight that. In my experience in time working in public service and specifically engaging the public housing community, I wouldn't be able to have the sense of direction or passion for change if it were not for change agents such as Ms. Blackwell, as well as the rest of my fellow great NYCHA leaders in Northern Manhattan, as well as in the Bronx and the broader New York City, who have all been able to provide a great insight to change agents such as myself in terms of how we should direct our advocacy. To answer your question, being raised in East Harlem, I live, right down the street from me is Carver Houses and Lehman Houses. East Harlem has, one of the largest concentrations of public housing, not only in New York City, but, the country. So it's only fitting that, a public sector, politically oriented profession such as myself would want to engage that issue. But on a personal note, my grandmother, when she moved here to New York City from New Orleans, Louisiana, ended up living in Lincoln Houses. In my time when I was, prior to birth, I was in my mother's womb at Frederick Douglass Houses. My grand aunt was, from Frederick Douglass. So there's a lot of deep background in my personal history in terms of public housing, but just overall, it's important that government maintain the safety net and just be able to, not only expand but strengthen, the current opportunities that are there. But it's not opportunities; it's hindrances. So we want to figure out a way to change that.
Mm-hmm. Well, what do you see today as the biggest challenge? I know there are many, but what do you see as the biggest challenge in public housing in New York City today?
I would say one of the key challenges is just it continues to be funding and a lack of consistent engagement around that whole issue. As you know, we live in a robust city which faces dynamic challenges on a daily basis. However, the people demand accountability, they demand action, and I just think that we're lacking in terms of seeing that level of involvement on the political level. Regardless of party affiliation, just overall, I think we just need to see all major parties better engage public housing issues as it is intertwined in all of our daily lives, because all of our friends and neighbors and relatives and just overall, the general American public should be focused on making sure that safety net programs are preserved, specifically public housing. If you don't have the shelter, then how can you prosper as an American, more specifically as a member of this community in New York City?
Mm-hmm. I'd like to throw this out to both you guys, both Diana and William. Are you anticipating any significant changes with the new administration, new HUD administration, and hopefully a friendlier and more understanding look at public housing from the Washington end of things. What's your take on the impact of the new administration in the near term on public housing here in the city?
I'll wait till William speaks and then I'll share.
Okay.
Well, I was figuring Ms. Blackwell would have some opening points, but overall, I'm very encouraged in terms of the administration's focus on public housing. I know one of the senior advisors to the president, Cedric Richmond, has been focused on the public engagement piece of the American Rescue Plan. I think it's important that we focus on incorporating public housing and the need for investment in the capital needs of public housing, but also addressing, operating subsidy proration and trying to maybe get back some of that funding that's been missing from public housing over the years. And maybe we can see if we can get retro funding from the government through this, new plan. I know it's not maybe the good timing in terms of highlighting other high-level priorities, but public housing is a need. It's a priority, as we outlined. Ms. Blackwell will attest to how important this program has been for her residents and will continue to be. But it's important that we get investments through the American Rescue Plan and hopefully the Build Back Better plan to not only strengthen job opportunities for public housing residents, but like I said, addressing the capital needs, but making sure that it's done in conjunction with resident leaders and community leaders who not only can provide great insight, but can also give you the day-to-day challenges that these residents are facing. It's good that noble public servants highlight these issues, but if you're not living in the thick of things and you're not seeking out input from residents who are facing these challenges, I just don't think the reform will be as impactful as it needs to be.
Diana?
Okay. When you're talking about the new administration, because they're not totally set up, I don't know what direction they're going to come from. Not only are we looking at a new federal administration, we're looking forward to a new local administration. And together they must look at the plan for NYCHA, but see, I'm also on a board that is a national housing board, and they must look at it across the 50 states and as well as Puerto Rico. I am not sure that they understand the vision to maintain public housing, not Section 8, but public housing, because I thought I liked the blueprint plan until someone pointed out to me that in order to save public housing, you have to convert to Section 8. When you say Section 8, then there's no more public housing. Therefore, you have no low income housing. And if you have no low income housing, who are going to reach out to the people with the low income? So I'm not too sure if going forward, the plans that are going to be presented are going to really meet the needs of the low income, or what they call ELI, which is extremely low income, until they have really reevaluated their planning around the economic situation in New York and across the United States to meet the needs of the people here or across the United States. So I'm not too sure until we hear from both federal and local administration what their plans are to save a true public housing.
Mm-hmm. Dan, maybe you could break that down for some of us that aren't as versed in some of the terminology. Why is Section 8 not low income? I thought Section 8, you had to qualify, you had to have a certain level, that a low level income to qualify. How is Section 8 not low income, and how does that knock public housing out of the box, as you say? You can just kind of break the distinction down.
Section 8 is a subsidy, which is subsidized again by the federal government at 70% of the AMI. Public housing when you apply, you are not really you don't have a pre-qualification. You just, well, it is pre-qualification. You have to be under a certain income, but you have, there's no structure that you're going to get money from this or that, or you'll have a voucher to move here or there if you want to. Public housing is just what it says. It's for the public, those who are in need. And Section 8, you must qualify. You cannot be past a particular income. And if your income exceeds it, you may lose your voucher that provides that subsidy from the federal government. So one is you're free to walk in with little or nothing, and we will place you in a home. The other one says you must qualify. You cannot be of a certain income. And if you are that income, you cannot get subsidy. So with the two different, platforms there, if everything in NYCHA becomes Section 8, who's going to take care of those that have no pre-qualifications to get into a Section 8 voucher?
Mm-hmm. And Section 8 is both the RAD program and the proposed Blueprint for Change program are both Section 8 based. Is that correct?
This is what I'm understanding with the Blueprint.
Mm-hmm.
Yes,
Okay.
RAD Impact will be a transformation into a Section 8 program.
So,
go ahead.
No, go ahead, Ms. Blackwell. I'm sorry.
No, I was just saying, and I don't know too much about the Blueprint, but this is what I'm understanding. They're going to use the Section 8 vouchers, which, believe it or not, there are no more vouchers. But if the government accepts the program, they will turn buildings into Section 8. And therefore, everyone within that building converts to a Section 8, mm-hmm. as does the RAD and PAC program. But if you were going to apply for a Section 8 voucher, there are none to apply for. The government has not opened that program again. But again, if there are only Section 8 programs, who in the public can apply for? If there aren't existing, who will be privileged to get into a public housing, which no longer will be public housing because it's no longer public, it's now Section 8, because they're defined by federal terminology, Section 9, public housing, and Section 8, which is the voucher program.
So it's two different authorizing rubrics under which public housing versus Section 8 comes.
Right. Section 9 would be public housing. Section 8 would be the federal subsidy program.
Right. Okay. Wait, you want to chime in on this?
Oh, yes, absolutely. Well, for one, I just want to, Ms. Blackwell, highlighted, the crux of the issue pretty efficiently. Just overall, I think that when we think about, access to information and, like we talk about the digital divide and just, impoverished communities being able to, digest this type of conversation and want to explore further, if the information is not readily available to them in some capacity, that there's a barrier for them, for any citizen to be able, for one, to learn more about that issue, but also figure out ways to not only address it, but possibly change it, which is supposed to be the foundation of our democracy. So I just think overall, a lot of many thought leaders, which is obviously this is an ongoing conversation, have kind of dropped the ball in terms of, and it's a collective effort. It's not easy, but we've dropped the ball in terms of just engaging our constituents, our community around policy oriented issues because of the depth of them and how much time it takes to dissect all of these key pieces of legislation and federally funded and codified programs. So that's why the burden is on change agents such as Ms. Blackwell, who on a daily basis, I'm sure, has to, and now with the blueprint being released, has to to disseminate some of these the key pillars of these programs to her residents. But we have to be able to come up with ways to be able to support Ms. Blackwell a little bit better, so that way other, other NYCHA resident leaders will be able to disseminate this information easily. And I think it's time for us to focus on getting, like I said, our policy-oriented change agents to come up with ways to get across, break that barrier, and kind of help people to know that there are ways to engage these issues. There's various platforms that I know that are out right now that can kind of help, address, those issues, such as one platform, Issue Voter, which is an interesting civic engagement platform that, engages legislative issues. It'd be great for platforms such as, Issue Voter and other civic engagement oriented platforms to engage, Section 8, rental assistance demonstration, or known as RAD, public housing or oriented policy and legislative issues. So that way we can kind of work on, like I said, addressing that barrier. But Ms. Blackwell is doing a great job already. Without some of those changes in mechanism being put in place already, going out there into the community and disseminating these key points.
One of the issues you raised, I think that dovetails clearly into the bigger issue is the digital divide, and the challenge that so many folks in public housing have in getting online and having the devices to get online. I don't know if you're familiar with, Diana certainly is, with the work of some of the stuff that my group, Digital Divide Partners, does with in partnership with resident associations. We're working together with residents to create their own network, to create their own Wi-Fi network, providing free Wi-Fi access, and perhaps even more importantly, providing a communications platform. We've created, in partnership with residents, something that we call the streaming radio stations. We created one with Ms. Velez at Johnson Houses about maybe 4 years ago. We have one with Carlton Davis at Grant Houses that we created about 2 years ago. And we're looking to create one this year with Diana at Fred Samuel. And essentially it's a platform that, gives a voice to residents. And it's a way for residents to speak their concerns and to communicate with each other on a platform that they control. And I think that's an important tool that could be used to help get out the information and the kinds of things that you guys are talking about, which are kind of complex, some of these issues. And we need to have forums where people can talk and share and discuss this stuff. And I think these digital platforms could go a long way in helping to make that happen. I'm wondering what your thoughts are on that.
Oh, well, for one, I know that there have been decreases in terms of funding, a lot of it in terms of resident associations, and, they're limited in terms of the funding. I think that, like I said, the burden now is on the federal government or the state government, or probably both, to work in concert in terms of providing funding for a digital and technological infrastructure for platforms such as the one you mentioned. So that way that there's the cost burden is shouldered by the government, because like I said, it's a federal public program. Public housing is a federal program. And I think, the federal government has a responsibility to its citizens, as well as to the American people to, encourage and foster the ability for its citizens to engage one another around these issues. We talk about all the time, like I mentioned, on both party sides, in terms of us wanting to figure out ways to energize our citizens around civics. Technology and access to technology can help address that. Platforms such as the one you just mentioned can address that need, but there's a heavy cost that is involved. So it's really important for us to be able to translate these conversations to shaping our lobbying efforts. While we're in the pandemic, I think people will still be able to field inquiries on the legislative level, on the federal and state level through Zoom. But I think we need to demand that there either a working group, a working paper, some type of commission, something be initiated to get the ball rolling. I was just having a conversation with a senior citizen a few days ago, and we were just talking about how to just disseminate and engage the people overall, and I just talked about the importance of taking incremental steps, so that way citizens can see that there is some type of step being taken. Obviously, Mr. Reid and Ms. Blackwell, both of you already are taking those steps and having affording citizens an opportunity to change things incrementally. But you need the support from government on the federal and state level in order to make sure that it can be robust, it can be swift, and you can be able to take those gains and be able to have it translate to some meaningful change for our citizens.
Diana, you have any comment on the digital divide and its impact and possible solutions in public housing?
Yeah, thank you, William. I really enjoyed that because you're right on. I have to say, from my personal experience recently, I'm part of the RAD transition at my development, and in the recent meeting we had with the residents, one of the qualifications for the upcoming developers who are bidding for this property is that they must provide access, the residents with access to the digital divide. So whoever wins the contract must be prepared to provide internet for the residents so that we can go, we'll be right where we're supposed to be. I'm just going to break it down, right where we're supposed to be in the midst of a pandemic. So good thing about the pandemic, this COVID-19, it has shown us that we cannot look outside of this digital divide. We must embrace it and bring it home. And whoever decides they're going to take hold of this new RAD pack must be able to make sure that every home has access to it, so that we will no longer find our people, Black and brown, behind in technology.
Mm-hmm.
So this is the good news. And I'm just thinking about the digital divide. As he was talking about seniors. Again, I'm working with a lot of seniors, and they're trying to, I know I'm a little ahead, but they're trying to book their appointments for the shots. They don't know how to use the system. How can we, in these days and times, bring our seniors up to par so that they can compete with everyone else trying to get their vaccination? Without this in NYCHA, we are going to lose another generation unnecessarily. It's absolutely necessary.
Yeah, I just like to chime in, just kind of based on my experience, and Diane, you've heard me say this before. I advocate for the funding and the developers that are coming in, that they provide the resources to the residents themselves.
Yes.
So the residents can create their own technology solutions.
Absolutely.
So the residents can create their own internet networks. One of the things we've done, William, is we're partnering on a nonprofit basis with other resident associations, creating a co-op where there's a cooperatively owned internet wireless network that's cooperatively owned and operated by residents. I really think that's the way to go, that where the residents themselves are empowered, where the residents have their network, and the residents also receive the funding to do the digital literacy that you're talking about, Diana. So we're not waiting for somebody else on the outside to come show us how to do it. We're taking that ball in our own hands, and we are devising our own programs and running our own programs to educate our own residents on how to use these digital tools and digital platforms to inform and educate and empower and uplift. I really think we got to get beyond the paternalistic attitude where oh, okay, somebody's going to come in and do it for us, and where we are going to take control and do it for ourselves. And all we need is the funding to do that, whether that be the feds, whether that be the city, whether that be the developer coming in, the rad developer, whatever, that funding go to residents, and that residents control, residents define the solutions and control and operate the solutions. I'm sorry to beat that drum, but I think that's really, really important. Otherwise, I think we're going to fall right back in the old trap where we're waiting for the government, waiting for somebody to do something for us, and in the meantime, we're sitting back and suffering and doing without. We got to take control of this thing, and I know that we have the resources. There's so much talent in public housing. I've seen it. I know it. All we need is the funding to come to us, so that we, the residents, can implement these solutions. That's my mantra. I'm sorry to kind of
I'm
have
going
to
to say
beat
this
that drum.
before. Okay, I'm going to say this before we give it back over to William.
Yeah.
But on behalf of HUD, I'm going to say two words that I always see in their grant application is self-sufficiency.
Mm-hmm.
Self-sufficiency, they're always promoting, but I don't believe, I'm going to speak for myself. I've never really tapped into the self-sufficiency, but that's what you're speaking of. How can we actually create our own resources? It's through self-sufficiency. We have to promote that we're going to do it ourselves.
Mm-hmm.
We just need the funds to get it activated.
That's right.
We will maintain, monitor, and execute it ourselves. We just need the funding to, again, begin it and maintain it.
Mm-hmm.
And if we can do this, if we can work on self-sufficiency, if we can go out and say we want to be self-sufficient, I believe we're going to find funders. I believe we're going to find the resources that are going to help us, because most people really want to see people do good because they won't be taking care of them. And
Mm-hmm.
that is not a bad idea.
Mm-hmm.
Self-sufficiency. And if we can do this through technology, I agree with you. Let us do it.
Mm-hmm. Okay, I just pardon me. I just got to say that you're listening to WHCR 90.3 FM, the voice of Harlem. This is Community Technology with Stu Reid, special guests Diana Blackwell and William Smith. And we're talking about public housing, the digital divide. And I think in a moment we're going to talk a little bit more. You mentioned it a second ago, Diana, about the whole status of the COVID vaccinations here in Harlem. You mentioned the context of some seniors and others not having the digital access and digital tools to access appointment availabilities. Tell us a little bit about your experience. And I know you're working with some of the leaders in the city to help make this happen. Give us an update.
Yes, I have to give a shout out to our borough president, Manhattan Borough President, Gail Brewer. She has started a COVID-19 task force, vaccination task force, and I am attending those meetings. And in the weeks that we've had it, which has been week number 5 this week, it repeats itself. The problem repeats itself, that the seniors are calling to make appointments and they're unable to access the system. If they are accessing the system and getting an appointment, or get to the point where they can make an appointment, it seems to drop them right at the end. So the appointment is not concluded. So many of them are waiting, and they're not waiting patiently. They're anxiously waiting. They're calling around saying, they actually used the telephone and it did not work. And it's been confirmed by Mark Levine. Actually, he was saying he was getting the same complaints, had his staff call, and the same thing happened. So technology is actually not working very well. But if we would encourage our seniors to perhaps not use the phone but use a computer, they don't know how. Even if they have access to a tablet, which some of them receive free tablets, they don't know how. I love what Nigel said. If you turn it on, once you find out where the button is to turn on, it will take you through the prompts. They're saying, what are prompts? And it will teach you how to use it. Well, first thing you have to get through number one. If you get through number one, you have to get through number two. And if you get successfully to number three, you have to sit through many things that you really don't understand unless you have someone there to tutor you. So technology is really wonderful if there is an educational component with it that is one-on-one or in a small classroom setting.
Hmm.
Our challenge is how do we get there?
Hmm. Yeah, Diana, I'm listening to you talk. I'm hearkening back to a project that Doug and I, my partner Doug Frazier, who Diana knows well, did with the housing development in the South Bronx, probably
Mm,
about over 15 years ago, around 2005,
mm,
2006. And in addition to a free computer giveaway, which we did in partnership with Perscolis,
mhm,
and the internet access, which our company Digital Divide provided, we set up a learning center
mm.
in the development where we had a classroom storefront, and folks would come in, and in order to qualify to get their free device, they had to take a 2 or 3 hour class.
Right,
And there were folks in there that would help them, that would go through a curriculum. Just basic stuff, like you said. How do I turn it on? What's the prompt? What's the mouse? What are you talking about? What's Windows? I mean, just real basic stuff. And I'd like to see that replicated. I'd like to see a learning center in every NYCHA development, where there's a learning center that's open, 1, 2, 3 days a week, where folks can come down and learn about the devices and perhaps even be given devices. But the requirement would be you got to learn how to use it, because it does no good to have a nice fancy tablet or notebook sitting on the shelf if you don't know how to use it. That's and
absolutely.
and and if you don't know, you don't know. It doesn't matter how
So true.
simple it
Yeah.
is. If you don't
Mm.
know, I mean, it really is a basic component that I think needs to be part of the overall solution.
Yes,
Yeah.
yes, yes.
But back to the vaccines, Diana. How is it going? Let me just also just say this. You talked about the telephone kind of being old technology and maybe not the way to access the information. It's interesting. My wife, who Diana, has been on the phone on the computer for 3 weeks trying to get an
Yeah,
appointment, and all of a sudden she got on one site for Walgreens Dwayne Reed, and all these appointments popped up. She was able to book it, and for the next day, this was yesterday, she booked it, went in today, and what she found out was that the computer system was down across all of Walgreens, and therefore all these availabilities were there once
yeah,
it came back up.
right.
And the guy said today, as of
Technology.
today, there are no availabilities.
Right, right.
So I'm just
Absolutely.
another crazy quirk in the
Yes,
technology,
yes,
totally booked up, but then the system went down, and during that interim, all these availabilities became available, and then
yes,
just as fast they disappeared again.
yes.
But if you're not facile and on top of that, and if she hadn't just so happened to go online,
Mm,
and when she
mm.
did, she'd have missed it.
Right, absolutely. I'm you know what? I know I want to go back, but I'd like to hear William what is happening there, and I'm going to then tell you a little story that's going to be quite interesting. But William, would you like to chime in about these vaccinations?
Well, for one, I had a personal experience with my grandmother. She's 84 this year, turns 85 in July. But more importantly, she, is not a user of technology. She does not have a cell phone other than the standard flip phone. And she does not use a laptop or anything like that. So, she relied on me in order to help facilitate her scheduling an appointment for a vaccine. She expressed her frustration in being able to find a location to get the vaccine. And, she's very frustrated given the fact that the government's been talking about all of these vaccines and wanting to protect seniors, and she's just has been very frustrated with the lack of presence and access to information to kind of address those needs. But that's why it's, like I said, it's always important for us to take that level of frustration and have it help channel our advocacy digitally now, unfortunately, due to the pandemic. But it also presents us with an opportunity. But I have that opportunity because thankfully I'm able to afford paying for internet service, both with my cell phone and home internet, as well as been fortunate enough to be blessed to purchase the necessary equipment to be able to have access to the information to help facilitate my grandmother's request with the vaccine. But what would we do if I did not have those resources or the digital tools you would need to address that that issue? We have to be able to figure out a way, either on the federal level and state level, if it should be able to be a way to tap into a simple phone call. They have 311 on the local level. There should be one when you have a national crisis like this. FEMA should have a hotline where citizens, depending on whatever forms of verification Congress and the states would require. But something needs to be done where you can make a phone call to get an appointment. And you should be able to call your local hospital or a local outpost location to assist you. And when you mentioned, Mr. Reid, in terms of having locations that can serve as an outpost for training, I know in the previous administration there had been a federal regulation and that accepted comments around envision centers, and those kind of being a way to kind of address some of the various socioeconomic issues and public housing developments. Obviously, I think that was just meant to be a starter of a conversation. In no way applauding the previous administration's effort, in terms of HUD. Obviously, I think they significantly dropped the ball and could have used a lot of the gains from the previous administration to get some benefits for public housing residents. But when you think about benefits in terms of the vaccine, I don't think public housing residents are seeing any benefits, and they're not seeing any resources being dedicated to them feeling reassured. And I think, most importantly, during the pandemic, ensuring that our citizens have that assurance that the government is at work, that their representatives on various levels, resident leaders, elected party members, government representatives are all focused on delivering a top product, which is, top service to our citizens who are our priority. And I just think overall in the general conversation, we forget that our priority is to make sure each and every one of our fellow citizens has access to opportunity so that they can address their needs as they arise.
Mm-hmm. Okay. Diana?
Yes. Okay. I want to kind of back what William said. He said the federal, state, and city, has basically failed us. And I don't want to say really failed us. They have been unorganized, totally unorganized. They're fighting to get the product in so we can service the people, but they failed in the organization of it. I am so happy to be part of the task force because they're bringing in the local people and saying, what can you do to help us when we get it? So we, the local people who know our community, we know where we live, we're able to give ideas, and we give it so they can take it back and bring it. And I will say this, speaking of NYCHA, I said, I'm offering my underutilized community center. It's closed for the season because it's basically a sports center. They're not under DYC regulation, so they had to shut down because they're a sports center. I'm using it 2 days a week, maybe 3, as a pantry. When the pantry is done, it's sitting there. Pop up, we have a community, not only of NYCHA, but I'm a different type of development complex. So what am I offering? I'm offering the community, surrounding community, seniors from everywhere, a place to get their shot if they would only set up a pop-up center there. It's not whether it's NYCHA or not, especially in my development. It's a senior life that we're trying to save. It's taking these small groups from within the city to begin to get this message across. When I said this, Gail Brewer, I love her. She went right to the city, got a call. The manager sent people in. We're taking pictures because we're considered to be a site. That local group implemented a plan. We haven't seen it implemented right now, but it started. It has been started. They're looking at this site as a pop-up vaccination center. This is what we need to do. We need to use the local organizations, the community organizations, to gather the people, to make sure they're talking about how are we reaching the people who are inbound. Well, one person says, well, I'm connected, or I'm the person who does the food. So we can make sure that everybody that gets food will get service within their house. Everybody getting food delivered to the house doesn't need inbound service. So when we're talking inbound service, we're talking about a nurse coming in and actually giving them the vaccination. Everybody doesn't need that. So I say to you, what about people who have home health aides? Why can't we go to the home health aid centers and say, if that person is taking care of someone, why don't we both vaccinate them and the person they're taking care of? They're getting ideas from within the community, the local. They're taking it and they're taking it back to the city on another level, because it's not working coming from the top down. It needs to work from the bottom up. And this is why we are really behind in what we're supposed to be, where we're supposed to be, because they're working it from the wrong angle. But it is changing now. We're changing it because people like me, and I'm not the only one, but I'm reaching out to my community leaders, my block leaders, and I'm saying, I got a call from this particular legislator. They have a site. Send me this much information, and we're booking it. We just booked 20 people while I was on the train last night to go to Convent. Yes, nice. 20 people. They were more than happy to get the 20. I got 2 more names today, and they said Convent is full, but we have Presbyterian. I'm learning, not from the city where the vaccination sites are on the line, but I'm learning from the legislators as I'm beginning to partner with them in trying to get the people done. If they work from the ground up, we will be more organized and people will get their shots instead of working from the top down. So, this is where I'm seeing this pandemic and how we're going to get people vaccinated.
Wow, that's powerful.
I just want to touch on a point, Ms. Blackwell, that you talked about in terms of how, NYCHA converted to Section 8 properties, how, obviously we don't want to see them transition out of the public housing stock, because then, certain safeguards and access to various funding mechanisms either would be limited or hindered, the transitioning to that current program. And I just thought about some key words that I heard. I heard want to see, I heard if, and I heard the key word need. And I just think about when we think about how programs transition, when we think about how programs are rolled out, we need to get things to change where it's no longer about I want to see this, where I provided this input to the necessary agency, entity, individual, and the issue was promptly addressed. Mm-hmm. And I just think of the level of proficiency needs to pick up in terms of our local government, like Ms. Blackwell said, doesn't start at the top, it starts at the bottom. But I think the responsibility and the burden is on the federal government and the state government to kind of set the structure or the best approach for the local level of government and the apparatus that engages the citizen in the local level, to be able to have structural ways to go about initiating its implementation or rollout of its programs, such as with COVID-19. There was enough time to be able to plan and to coordinate where Ms. Blackwell wouldn't have to think about providing all of the necessary feedback and need for change to the necessary elected officials or community leaders to get things rolling in a more efficient way. You shouldn't have to do that because then it slows the resident leaders down, and it, like I said, it dilutes the quality of the service that we want to provide to our citizens.
So Diana, how are you getting word out to your folks about your program and prospective new programs? How are you disseminating information?
Well, first thing, I built a network where it's just an easy call to the leader, whoever is leading the part of the network I'm trying to reach, and they're able to disseminate, because I'm unable to do it because anyone knows me, I wear several hats, and in order to really focus on one thing, I have to have other people who are community leaders or leaders in their little circle do this. So as long as I'm able to network with the local leaders, they're able to get information back to me that I can use to help them.
That's great.
All about networking. It's all about networking.
I like to see if Diana, maybe sometime over the next month or so, I'd like to maybe see if we could do a streaming from your location where you're working, where we're talking to residents and seeing residents getting service, getting vaccinations, and just as a way to kind of help get that story out and propagate it further.
That would be interesting. Yes.
Yeah. Okay.
That would be very interesting.
Okay. So I'm wondering, we're down to the last 5 minutes or so. I'm wondering what you guys are thinking, if anything, about the upcoming mayoralty election in New York City, and what impact that may have on public housing and digital divide and COVID and some of the issues we're talking about. That's something you guys have looked at, or am I being premature?
No, I don't think you're being premature at all. I think you're right on time in terms of looking for feedback or around that issue. 8 years ago, I remember I worked on the mayoral campaign. We were talking about public housing. The campaign that I was on, even provided a promise to public housing residents if they were potentially elected on how they would engage the issues. And we're still hearing a lot of the same issues. I mean, obviously, the federal government, created the RAD program, so that provides a new funding stream for public housing. But the new mayor is going to need to lobby the federal government to see various changes made on the federal level, as well as in terms of public housing. The state has a responsibility to provide funding for public housing, and in a larger way, public housing being undercut. The public housing funding has been undercut through several years, though I know the legislature has tried to take some steps to alleviate that with some minor appropriations. And I say minor, though not minor in terms of the dollar amount, but minor in terms of their the tangible impact that the dollars would have. So pretty much the mayor of New York City will need to lobby the state government and the federal government for a robust federal subsidy, both on the capital side and operating side, to make sure that public housing developments get the money they need to improve repairs, improve conditions of life, but more importantly, as would be most important, as we've been talking about, eliminating the digital divide and using infrastructure dollars and the local government, the mayor's office, to work on speeding up eliminating that divide, because the mayor has the ability to tap into local resources to address those issues. So I just think it's important that all of the mayoral candidates should be able to have a solid, tangible plan and be able to articulate what their first steps would be, first 100 days. I think that public housing should be declared a crisis in terms of its service to New York City residents. But it's important. The burden is on all of us change agents to work on educating all of our fellow citizens during this season to make sure they challenge the assumptions of these mayoral candidates, make sure they ask them the tough questions and hold them accountable in terms of where they see the direction going around public housing.
Mm-hmm. Diana, your thoughts on the upcoming mayoralty?
The mayoral race, that's really, when I heard that we have over 40 candidates, I'm still in shock. So I'm not too sure where it's going to go, because I'm not too sure what anyone's true agenda is. But have either one of you ever seen the story about Pruitt-Igoe?
What's the name again?
Pruitt-Igoe.
No.
Okay, please, if you get spare time, look at it. There's an author who actually did a video that was shown at one of my conferences for my national housing group. And what it was in the 50s, early 50s, a housing development in Missouri that actually, it's such a horror story. People lived in it with the place, cracked windows, frozen pipes. People of color were still living in it. The city refused to fix it, because when the whites moved out, the blacks moved in as their second home, and the city never fixed it. I honestly see us going into that stage unless we have some genuine help. I've not seen anyone with a sincere plan to save public housing. Everything is, we want to be the leader of New York City. We will tackle public housing, but there is no real heart felt drive there for them. And we're doomed for deterioration, a breakdown, just a total failure of public housing. I don't know really what to say until we hear somebody that has a sincere heart, because you can't move this with 400,000 people living here, and probably more, because a lot of them are undocumented. Until we can really find someone that's really sincere. Lobbying, we can say lobbying in the fact that they're going to talk to people in Washington, but public housing does not have lobbying. We now have a federal monitor who is doing what he said. He's monitoring whatever is going on. But I don't know if we yet have any real results, because we still have people coming up with lead poisoning. I think the new vision is we're going to take care of RAD. I don't know. But until we get a mayor that has a real heart to assign people to really look at the issues, to not let this become a Pruitt-Igoe, we are headed towards it. I personally am a RAD PAC person. A lot of people, I'm of a small minority, but I refuse, after understanding Pruitt-Igoe, I refuse to allow myself and those that I am leading to live a Pruitt-Igoe. So I encourage you to, watch a little bit of it. They have clips, small clips, and then understand that until I see a mayoral candidate with a heart to really save public housing, I don't know yet, and I haven't seen it yet.
Wow, that's honest and straightforward. I appreciate that. Thank you, Diana. Well, we're just about out of time, folks. I'd like any final comments, any final thoughts that maybe we didn't talk about or that you want to reiterate. William.
Well, I just want to make sure, just to follow up on Ms. Blackwell's point, that the next mayor you know, the next mayor's next budget includes investments to work on addressing, you know, the lead and mold issues in public housing. When I mentioned you mentioned the monitor. It's all good to have a monitor, but we need some type of enforcement mechanism and an entity that can provide the resources to address the issues immediately, so that we can no longer continue just highlighting and talking about issues. We can work to address them. And we need a mayor that can bring together the city resources and the relationships across the state and the federal government to get New York City public housing the resources, the funding, the money, the support, the attention that it deserves to be able to move forward, so that way they can no longer deal with being from operating from behind, and can finally be able to focus on moving forward, so that way our community can be stronger from within.
Mm-hmm. And final thoughts, Diana?
Well, I am just excited. I'm excited not only about public housing, but I'm excited about the vaccination process. I am excited because I know that it's working where I am. It's a small scale working process, but I know from the ground up, we're going to get as many seniors that want to be, they have to want to be vaccinated. And I'm using my resources to make sure it happens. So I'm very happy to say that it is working in my little community.
Great. Well, I want to thank Diana Blackwell, president of Fred Samuel and PSA 6 Community Council, and William Smith, community and civic advocate and organizer, for joining us today on Community and Technology. And thank you for the work that both of you guys are doing. Very important. Thanks so much.
Thank you so much for the opportunity.
Absolutely. This is Community and Technology, every Wednesday from 5 to 6 p.m. on 90.3 WHCR FM. See you next week. Good night.
Good night.